exciting concept. A concept where we bring together people from different disciplines to solve complex problems, particularly the disciplines of environmental health, human or public health, and veterinary health. We have an international source for food products today. What we eat today may have been picked in the fields halfway around the world 2 days ago. And so to go through all the complexities of tracking where those food products might be contaminated with infectious agents, well, it's no small feat, and it takes a specially trained individuals, professionals, to work in this area.
Colleges of veterinary medicine across the nation, indeed across the world, have now recognized that there needs to be specialized training for veterinary students in the area of One Health. The importance of the recent epidemics in terms of how they've spread from animals to people has made us recognize that we need to work together much more closely, and also to work then with other professions.
It's hard for me to not think of science as One Health. Most of the projects that I'm working on in my program relate not just to a specific area of science, but to all of the things that lead up to it, that cascade together in a dynamic sense that allow events to happen in nature. So it doesn't matter whether we're talking about environmental health and it pertains to organisms that live in the environment, or environmental health with regard to humans living in the environment.
There's a lot to know. There's a lot for students to know. There's a lot for us to know. And we can get to know it better by cross-fertilization, by looking at what others are doing in other fields and seeing the commonalities, and maybe something that might not be so obvious that would lead to integration to accomplish a particular objective.
We have access to so many different professional colleges, so many resources, and the ability to collaborate with so many different professors and other graduate students in other colleges that are doing projects that might not be exactly what you're doing, but relate to it so that you can further develop your research interests and really delve into your research further.
We're developing a portfolio of research opportunities for students. The portfolio would first engage students at a level that would involve a year of their time. The next level would be a master's degree that might take a little bit more time, as much as 2 years, to generate some experience and some knowledge in the One Health realm. And the final level of training would be a PhD program that would involve somewhere in the neighborhood of 3 to 5 years, with a lot of leadership training, such that individuals that have this high-level degree would be independent team leaders in the One Health realm.
I think this is a pretty unique program because I think lots of folks, they have little concept, particularly of where their food comes from and how it gets to them. And so if they understand a little more about how it's produced, and certainly if they have some appreciation for the firewalls and some of the interventions that we utilize to try to maintain safety and wholesomeness the best we can, then they would understand why that would work when they got into a human system as well.
They bring all of these different disciplines together, and you're able to collaborate a lot more closely and able to utilize resources together to solve problems and look at different ideas together. We are studying cattle workers for past exposure to some cattle zoonotic pathogens of concern. This study is looking at the environment that these cattle workers are in, plus their activities and the animals all together, to see what we can learn and ultimately, hopefully, prevent some of this transmission that's occurring and prevent human disease.
You put it all together and you've got a tremendous amount of expertise that cuts across the normal boundaries, not only the boundaries between disciplines within human medicine, but also across the boundaries between animals, plants, and humans. Now, EPI was created specifically to take advantage of this diversity, but to give it a focus, to provide a base where people could come from multiple different disciplines and work on common problems.
It's not atypical that collaborations with my projects include our College of Veterinary Medicine, our College of Public Health, our College of Medicine, our Institute for Food and Agricultural Sciences, our Water Institute, and our Emerging Pathogens Institute. And that's not just a long list of names to be impressive, but mostly it's a list of the expertise that is at our fingertips here at the University of Florida. And it brings to bear to every single research project because it has expertise that I don't have. It allows that One Health perspective to come through. What is the functional relevance to the research that I'm doing? And how can that have relevance to the world around me so that it's more than just a publication?
If a student comes here with a specific interest in mind, we can almost always find somebody that he can tremendously learn from and build a platform that will help him or her in their professional career.